I'm Dr. David, and this is about your health and your life.
This is the Dr. David Show.
Welcome to the Dr. David Show on this Wednesday afternoon. I'm Mallory Brooks here with Dr. David. Always great to have you here. And he's going to be answering your health questions in just a few minutes. 501-340-4922 is the number to call, and we will answer your questions in just a few moments. But today we're talking about heart disease.
Right, unusual causes. And here's an interesting fact. Recent research has shown that minor amounts of inflammation in the body causes the release of molecules into the bloodstream called cytokines. These cause damage to the walls of blood vessels that lead to the deposition of cholesterol and a higher risk of heart attack and strokes. Amazingly, the most common cause of inflammation increasing this risk of heart disease is inflammation of the gums. Watch this.
I spent a lot of time staring at the ceiling of a dentist's office. As you can tell from my x-rays, I've needed plenty of work done on my teeth. Today I'm in for a checkup and a cleaning. Good dentists like Brian Dunlap encourage patients to take care of problems as soon as possible.
Letting these things grow and develop into bigger problems will end up costing the patient a lot of time and a lot of money and possibly losing a lot of teeth.
Dr. Dunlap is absolutely right. But there's another reason to maintain good dental health. Here's how hygienist Sherry Grossman explains it.
You will live a much shorter life with gum disease.
It's because people with periodontal disease are almost twice as likely to suffer from coronary artery disease. That means they're at huge risk for heart attack and stroke. Studies also show a link between gum health and diabetes.
Patients are becoming more aware of that, which is good because a lot of times people think, my mouth's not associated with the rest of my body.
Research shows that gum disease, even cavities or missing teeth, are as good at predicting heart disease as cholesterol levels. So we have to pay attention to what leads to problems.
Smoking is a huge factor. It's probably the number one.
Many people also have a family history of gum problems. And as you learned in grade school, you've got to brush and floss frequently and properly.
We're not asking you to brush your teeth for 15 minutes at a time, but the time that you do brush your teeth, if you'll spend the time getting on the gum line real thoroughly and also getting the back teeth.
Regular cleanings like this help prevent problems and alert us to potential issues. But you should look for warning signs at home too.
Healthy gums don't bleed, period.
My teeth are looking much better. Just one little cavity. That's no reason to feel down in the mouth. In fact, I feel great knowing I'm keeping my gums healthy and preventing chronic disease at the same time. Remember, you may not like going to the dentist, but believe me, it's a lot easier than going to the cardiologist.
Well, welcome back.
That's right. We are back with more right after this. Stay with us. You're watching the Dr. David Show.
I think I look sun.